The common side effects of chemotherapy varies between individuals. Everybody is built differently, so everybody will manifest a different side effects of chemotherapy. Generally, some of them will have hair loss, some of them will have nausea, some will have vomiting. Some people might experience diarrhea, while some people will actually experience constipation. Some people might have numbness of the peripheries like your hands and your feet, but some people might have a darkening of your nails. Some will have loss of appetite, some people will lose weight, but some people can also gain weight also. Important thing is there are 100 kinds of chemotherapy drugs and not everybody is treated the same. Everybody is given different kinds of chemotherapy drugs based on their cancer cells. So everybody will have a different kind of side effects generally. Generally, chemotherapy has some very serious side effects, such as it will impair your blood counts, where your red blood cells, your white blood cells and your platelet might drop down after chemotherapy. So when this tends to drop, people might have an increased chance of having infection. Okay, you also have increased chance of bleeding. There are many ways to reduce the side effects of chemotherapy. Importantly, you need to have a strong body, a strong immune system. Okay? One way is to eat right. Okay? Always have your nutritious and balanced meal. If you are unable to eat normal food, there's always formulated supplements for cancer patients, okay, which is specific for cancer patients and it is proven scientifically. It can be used as a meal replacement if you don't have an appetite. The important thing, you need to maintain your body weight also. Nausea and vomiting is one of the common side effects of chemotherapy, so always take small amounts of food instead of a large meal. Small amounts of food tends to get easily digested and reduce the nausea and vomiting feeling. There's a lot of newer generations of drugs which actually we use for our cancer patients, such as a good anti-nausea vomiting drugs, a good antidiarrheal drugs. Important thing is to actually talk to your patient. I normally advise my patient, always keep yourself active, try to exercise. Fatigue is one of the main problems with chemotherapy, so always try to do some light exercises like brisk walking, some tai chi, yoga, qigong, something which keeps yourself active, and also eat right. That will actually reduces all your side effects of chemotherapy. The side effects of chemotherapy generally tends to get worse with cycles. But the important thing is the patient needs to explain to the oncologist, and we can always try to adjust the dose of chemotherapy. The aim of chemotherapy is to kill your cancer cells, but also you need to have a good quality of life. There's no point going through chemotherapy which reduces your quality of life. So if say the side effects is getting worse for a patient, talk to your doctor. There's a lot of ways we can actually reduce the side effects of chemotherapy, such as dose reduction, such as prolonging the chemo cycles.